Hello, everyone. Thank you for joining us and coming back to the WMFC Ed Forum that's done virtually. Now we're moving into the patient panel portion, and we're going to hear from a few Wallies, and that's what I call us, is Wallies. I'm from the BC Wallies support group. I'm one of the facilitators along with Kit, and we have a wonderful group, a friendly group, and we meet every month on Zoom, and we keep growing. So if you're from BC, join us, the BC Wallies. You can find more information on the WMFC website. We're going to hear from four men, Chris, Paul, Mark, and Dean. And they all have varying stories because we've heard this before, maybe you haven't. But if you've seen one WMer, you've only seen one WMer, meaning everybody has a different journey, some similarities, but everyone has a different journey. And we're going to hear four really different journeys coming up now. And we're just glad that you're here. Remember, these are not professional speakers. They volunteered their time with a little cajoling from some of us that know them. And we just really hope you're going to enjoy hearing their journeys and take bits and pieces and tips and advice that they may have that you can apply in your journey with WM. So we're going to head off and start with Chris coming to us from Toronto. And Chris, I'm a little nervous, I got to say, because I know you are a professional at this because you did a live show in your past life.
Yes, I'm doing great. It's lovely to see your wonderful face coming all the way from Spain, I think.
Yes, I am on vacation in the Costa del Sol, and but this is a really important thing, and I'm honored to be asked to moderate this. And for those that don't know me, I tend to talk a lot, but we're going to hear presentations from the four guys, and I will be piping in with different or thoughts, and we'll just go from there. And then we're going to have a round robin with everybody and having more questions then. So go ahead, Chris. Tell us about your journey.
Let's kick things off and say good morning from Toronto. And really, I'm on this patient panel, I think, Brenda, because I'm new and boring. New because I was first both diagnosed and treated just this year. And boring because I received the current standard treatment and my experience is just about as mainstream as WM ever gets. So this presentation is going to cover what I would like to have known before I started my own WM treatment, and I hope it's useful for those of you listening in today. My life before WM was also pretty mainstream. Aged 67, in total denial of my pensioner status, married for 40 years with two grown-up sons and living here in Toronto. With a career in the travel industry, latterly as host of Canada's most popular travel show on radio, and I retired 5 years ago. Passions were traveling, unsurprisingly perhaps, and running. I visited over 100 countries and run over 20 marathons. And up until 65 years ago, I led a charmed life health-wise until I was diagnosed with prostate cancer a couple of years ago. So, how did my diagnosis of WM come about? Well, after my prostate cancer diagnosis, I opted for the most direct approach and whipped the offending organ out and got to see the inside of a hospital for the very first time. Later in the year, I returned to traveling, kept on running, but something wasn't quite right. I was unusually tired during and after my runs. I was having dizzy spells and my resting heart rate was abnormally low, even for someone who was relatively fit. And I couldn't throw off the anemia from my prostate operation. So I made a very rare visit to my GP. And not having seen me in decades, she did take my concerns very seriously and tenaciously directed me in sequence back to the prostate cancer team, to a cardiologist and the gastroenterologist. And finally, it was the hematologist who ordered blood work, which revealed very high IgM, low hemoglobin, and a blood viscosity, which was described in typically Canadian terms as being more like maple syrup than blood. After a bone marrow biopsy in January of this year, WM was finally diagnosed with an immediate ban on both driving and running. So my treatment kicked in very fast. Treatment lasted from February until August, and today I'm in my, I guess, third month of official remission. My treatment
Yay!
was yeah, I know, it's great. Never
That's
felt more
awesome.
happy. My treatment was the current preferred systemic therapy regimen, WM, bendamustine and rituximab, administered in those 6 one-month cycles that we've already heard about. And here I am, relaxing in Princess Margaret Hospital in Toronto as the Benrit does its thing. And additionally, I took 2 drugs on each chemo day to minimize both allergic reactions and nausea. And then each cycle comprised of 2 days chemo, followed by a week of maximum side effects, 1 week of the lowest immunity, which was dauntingly called the nadir, 1 week of feeling increasingly better, and then blood work, consult, rinse and repeat. So my experience of chemo was probably fairly typical. I was very anxious leading into the first cycle, not knowing what to expect. And the first IV session is a long, long day. In my case, it was about 8 hours as the nursing staff carefully slowed rates of IV flow in case of allergic reaction. I was sternly warned to watch for infections and to race for emergency if my temperature exceeded 38 degrees centigrade. Well, this happened just once, which was in my second cycle, when I picked up an infection at the site of my rituximab injection. And Emerge at Toronto General is not a pretty place, but I had been fully prepared on how to present myself as a chemo patient, and a dose of IV antibiotics controlled the infection almost immediately. My last chemo cycle was delayed as my white blood cell count indicated neutropenia, and that was really frustrating as I just wanted the whole thing now to be over. But finally, after 6 months of treatment, I got to ring that bell in the cancer ward, and this was and still is an unexpectedly emotional moment. Now, I experienced most of the side effects promised by my oncologist, but I did avoid the worst of them for sure. I didn't grasp how both constipation and diarrhea could both be a problem until I experienced that yo-yo effect in the first few days after chemo each month, trying to balance one against the other. I didn't expect to change overnight from a caffeine addict to hating the taste of coffee. But the good news was no vomiting, no mouth ulcers, no eye problems, and no hair loss. So I grew my first beard immediately just to show myself in the mirror each morning that it could be worse. It was challenging to shift from a lifestyle under control to not knowing what symptoms and side effects were going to hit next. It seemed, and maybe it is, somewhat of a lottery. I also struggled with no firm guidance on how much and when to socialize when immunocompromised. Likewise, my oncologist could not commit to what my next monthly IgM target should be, let alone the target at the end of the chemo. And longer term, the likely length of remission. And of course, the big one, what was my likely life expectancy? I was, however, firmly advised not to travel during chemo, which is pretty tough for an inveterate globetrotter. I was allowed to restart running, although with the expectation that fatigue would rule this out. Well, it didn't. I was able to run for 3 out of the 4 weeks of each monthly cycle, which was a boon both physically and mentally. So, what did I learn from my treatment? What lessons and advice can I pass on? Well, firstly, despite the challenges of 6 months of chemo, the quality of life is actually okay. It's really important to be your own advocate. I wish I'd been much more forthright right from the start. Push for treatment options, push for trial opportunities, and if side effects are problematic, then push for solutions to those. And despite being warned that the chemo side effects build up over each cycle, I really didn't get it until I got it. So do save some resilience for those last couple of months. And some positives. You might be immune compromised, but you don't actually have to hide at home. With appropriate caution, you can see family and friends and appreciate them. and always the Zoom. Cherish your caregiver. My wife Dara's tenacity and her patience and her care kept me sane over the 6 months. The quiet time is also an opportunity to complete those long neglected projects. I was actually able to write up a journal that I'd made on the hippie trail traveling across Asia nearly 50 years ago. And the monthly consults with your oncologist, which in my case is the wonderful Dr. Bella, well, they're hugely valuable, so treat them as such. Prepare for them, write out your questions and concerns in advance, and track all your blood test results to focus on what you now know is important. Initially, my monthly blood work was scheduled only an hour before my consult, so we couldn't discuss those current numbers. So I somewhat unilaterally moved my blood work a couple of days earlier, so we could be looking at those latest numbers during the consult. I also composed a kit list for my chemo sessions and packed the bag with all the stuff in the day before. Everything from headphones for a chemo playlist to snacks for that lengthy first day in the chair and a squeezy toy to throttle as the needle went in. We created a calendar for the first few months and then the full 6 months to see at a glance all the appointments when I was most immunocompromised and when we could plan to see family and friends. I refused the anti-nausea drugs in the first cycle. I just don't like taking pills. Oh, that was a bad decision. They
Don't do that.
definitely, no, they're not. They definitely alleviate nausea in that first week of the cycle in particular. And getting the right dose of Cedicot or whatever you take, or constipation med, it's really something to focus on right from the start to get that balance right. 3 things I found massively useful. First of all, keeping active. Now, in my case, that meant running 10 kilometers each day, but walking 1 block is just fine. It's the mental and physical benefit coming from doing whatever you can. Secondly, don't be afraid to lean on family and friends. You will find them there for you as the cycles lead on. And thirdly, do join the WM community. Our cancer is so rare that there is comfort knowing that you're not alone. Both this organization and the IWMF provide great information, and the regional support groups bring camaraderie and a perspective on how your experience compares with others. Doesn't it, Brenda?
Yeah, thank you so much, Chris. This is really good. I do have one question, well, maybe more, but the first one that comes to mind is you said that you had a typical, so-called typical journey so far with the diagnosis of WM. But there's one thing that really caught my eye because this has all happened to you in this past year, in the last 6 months. Your diagnosis was actually, in my mind, quite quick. How did you get a WM diagnosis so quickly? Because for me, I'd had symptoms for years, and I know many other people have weird little symptoms for years. Very difficult to finally get the diagnosis, but you seem to get a diagnosis really quick. Is it because your doctors were there, or your previous cancer, and you're sort of in the system already? What was that?
Well, it did come quickly and it didn't. I mean, it took me 6 months really, from about the middle of last year to the end of last year to actually get the diagnosis. But I had a wonderful GP who was terribly tenacious. She knew if I was coming to her, something wasn't right. And so she went through all the things that she could think of until we came to the blood test that revealed the high IgM levels. Once that was seen, I had my biopsy within a couple of weeks or so. They were very worried about I had high blood viscosity, and that really was what was messing about with my running, and that was why I was feeling so exhausted after my runs, I think, more than anything else. And with a very high blood viscosity and a relatively high IgM level of 56 or going up to 60, they wanted to start real soon. And as you can see, I mean, my IgM came down to 14 after treatment. The blood viscosity came down to relatively normal. And after 6 months, I've got the remission after 3 months and no maintenance therapy scheduled at all, which is great. I've got obviously dodgy immunity for another 18 months, and I've got to deal with my prostate cancer now coming back. So I've started radiotherapy just this very week. We'll
Oh
see how.
my.
But multiple cancers in 1 year have actually made me interesting enough for them to genetically test me for all the 76 cancer markers that they can currently test for. So that's going to be very illuminating. But my energy levels are right back where they were before all this began. And I was able to actually run the Toronto Half Marathon last month, which
Wow.
surprised me greatly. Um, so it's great to be feeling better, and I would say too, planning for the future I think is a very important part of what you should look for as you go through this process. Because if you can retain that positive attitude, you can start to look forward to all those things that you may be putting off now, but that you can do later. And so for me, for instance, obviously that's going to be travel again, and we've got all kinds of wonderful bucket list trips planned for the start of next year. Oh, yeah, just a few last thoughts. You've already said this, Brenda, and it's so true. If you've seen one WM patient, you've seen one WM patient. Every one of us is different. So everyone is going to go through a different path. But there are some commonalities, and I hope we've been able to explore some of those. And there are two light-hearted tips, but sincere tips that I'd like to pass on. One is to think about, during the course of this 6 months, maybe to adopt a therapy kitten. And exercise is good, but don't forget napping. Napping is wonderful too. And if you can combine the two, as you see I'm doing here, that's even better.
Wow, that's so great, Chris. Thank you for your upbeat presentation. Even though I know it's been a difficult year for you. This is you said you had like how many marathons under your belt, and now here is this is a real marathon, right? We're in it for the
Yeah.
long play for this diagnosis, and I guess you weren't expecting this. None of us were. But you're
Came
good
from a
with
clear
marathons.
sky.
So oh, I didn't hear what you said.
Sorry, I
Maybe
said
my
it came.
could be
Yes, you're right. I didn't expect it. It came from a clear blue sky, and who had heard of something as ridiculously named as Waldenstrom's macroglobulinemia until you have it.
How long did it take you to say it correctly?
Oh, I had to practice that one a lot.
Yeah, for sure, for sure. And if anybody didn't catch it, he said to take the anti-nausea medications
Yes.
before the chemotherapy. Got that? On Dancitron was my friend. Um, After I didn't take it on my first cycle, and boy, did I pay for that. But if I would have had it before, no problem. All right. Thank you so much, Chris. You did an awesome job. And now we're moving on to Paul from Montreal. So he comes to us having a different experience. Hello,
Yeah.
Paul.
Hello, Brenda.
And he's had ibrutinib. So let's go in to talk about your story. And I know, Paul, you're from Quebec. So I know you wanted, and I would like you to say hello to our friends in all of Quebec en français.
Oh, ben, certainement. Alors, je viens de la province de Québec, mais j'ai vécu à Québec pendant 35 ans, alors je connais très, très bien la ville de Québec. Et ça me fait plaisir de saluer tous les gens du Québec qui sont à l'écoute et en espérant évidemment que assez tôt, assez rapidement, on puisse avoir des sessions à la Fondation qui soient vraiment complètement bilingues. Mais pour l'instant, en tout cas, on va se contenter de transcription avec un certain délai. Alors, bienvenue à tous. Welcome everybody. I was asked to participate because I'm an old timer in terms of Waldenstrom macroglobulinemia having been diagnosed 14 years ago. You are an old timer, and since those 14 years ago, I've had chemotherapy twice, and then the last 5 years I've been on ibrutinib. I was diagnosed indirectly, as most people probably. I had severe hip problems, and the doctor asked for a PET scan of the pelvis. and the radiologist saw that the bone marrow of the pelvis was invaded with suspect cells, which turned out to be cancer. And so this was followed immediately with a biopsy. And when the biopsy results came out, it was Waldenstrom macroglobulinemia. And so, as I said, I had 2 rounds of chemotherapy. After that, I was operated on for the hips, and I have 2 absolutely marvelous metal hips that are doing a great job, and without absolutely no side effects, nothing. I mean, I just I've forgotten them for the last 14 years, 13 years. Uh, but when my IgM was getting up and symptoms started coming back 5 years ago, my oncologist asked to have another biopsy done to see if I had the correct um, shape of my, what is it, mid 88 cell, and it did turn out that uh, I could be a good prospect for ibrutinib. And so, but at the beginning, I was taking 3 pills a day, which was the dose recommended by the company, by the farmer. And I developed atrial fibrillation, which
Oh,
had to be
yikes.
taken care of by my cardiologist, and it did control, kept that under control. But as I was following developments on the IWMF newsletters and then publications monthly, I saw that it was more and more recommended that the dosage be reduced to 1 a day instead of 3. So I came up to my oncologist with that information, and she did, a little bit reluctantly, but she did uh, consent to reduce my dosage from 3 to 1 a day, and it proved to be absolutely perfect. 1 pill a day does the job as well as 3 without atrial fibrillation. I mean, I have had no heart problems ever since. I mean, and the IgM is so low that she says it's barely discernible. So really,
Right.
this one pill a day. By the way, I take the pill with a completely empty stomach. I take it very early in the morning, but I don't have breakfast until at least an hour after that. So my stomach is really empty before, and it stays empty after. So I don't know if that does. If that helps at all, but I certainly get excellent results from ibrutinib, and very satisfied with what is going on now. The only other, side effect that has nothing to do with ibrutinib, with Waldenstrom, was that I got shingles. Uh, very
Mm,
shortly after I started on ibrutinib, but obviously that's probably not related. It's just, and so that was quite a problem for a few months, because the shingles hit the right leg, and I got partially paralyzed in the right leg, and so I
wow.
could. The first time I discovered that, I fell down the stairs head first, because my right leg was completely out. I mean, it was just non-functional, and eventually it turned out to be shingles, and so that was a pretty serious problem, but not related to Waldenstrom, of course. So, if I have anything to say, to add to what Chris was saying, which was absolutely brilliant, I would say trust your medical team, trust your oncologist, become good friends with your pharmacist, um,
Mm,
because uh, at least in Quebec, ibrutinib has been approved since for over 5 years now, and it's important when you take a very specific and very highly specialized medication like that that you stay in close contact with your pharmacist who knows all your other medication, all your other symptoms, and can be very helpful to in relationship with the oncologist, of course, but can be very helpful. And he was indeed. And one maybe one point about the my experience is I had biopsies twice, two biopsies, and one day I was talking in the waiting room at the hospital with other patients, and half of them for half of them biopsy was a walk in the park, and for half of them it was absolutely a descent into hell. Well, I had two biopsies, and one was a walk in the park. The other one was a descent into hell. It fit the picture exactly. So if you do have to take a biopsy, you can expect one or the other, but the chances are probably 50-50. So
I would agree with that, actually. I
yeah,
would agree with that. I
yeah,
had the bone marrow biopsy. That's what he's referring to. It wasn't fun, but it was okay. It was doable. I think it goes back to who's doing it and how many times they've done it. My second one, which normally not everybody needs a second one, but sometimes. And my second one was the walk through hell. I did not enjoy it, but I think that also along
yeah,
with the doctor and how many times they do it and their technique, but also I think it's your mindset, because I knew what was coming now, so that
mm,
made it worse.
yeah, possibly. Yes, the first one, which was a walk through hell, was done by a young doctor who's obviously it was the first time in his life that he was doing it. So
Yikes.
that he was doing it by himself, on his own. So
Oh
that
my.
probably has something to do. The second time was obviously by a very experienced doctor, and it
Yeah.
went very well, very easily. So
Good, good.
that's what
Can you
maybe
tell
one.
me, yeah, I have a question. Can you tell me,
Yeah.
Paul, how much, so you had 2 rounds of Bandaritux, and then you were in remission for how long before
four
you needed
four
to have
years,
another therapy? 4
4 years.
years.
Yeah, yeah.
And those were good years?
Well, not at the beginning because of the hip problems. I mean, it was really extremely painful, and until when the hip problem was solved, then of course there were, it was fine. And at that time, I retired. At first, I was on sick leave, and then after being operated on, I retired, and I've been very active since. Really, it's with very little side effect except for the atrial fibrillation following ibrutinib uh, and the shingles. But I mean, very little other side effects from the Waldenstrom itself.
Right, right. And I think that's important for everybody in the audience listening, is to hear about your journey. You did
Mm,
do the chemo. You had, a bunch of good years, relatively speaking,
yeah,
regards to WM specifically.
yeah,
And then you had another therapy, and this is your one magic pill a day,
it
and
is.
it takes all your ailments away,
Yeah,
which I think is fabulous. You said that you are encouraging everybody to trust in their medical team, but I
yeah,
feel like you missed one very important point, which is trusting yourself, because you had done a lot of research. I can hear from you, and we talked before. You were in on the IWMF, the Torch, right? That's the publication. You'd
yeah,
looked around, you'd done your research, and you
mm,
had heard with AFib, you can go
mm,
from 3 pills down to 1 pill. It's a possibility, and it may work. And you brought that to your medical team. Of
yeah,
course, don't do anything without consulting your medical team.
mm,
But I would say that's a big thing, right? Chris talked about advocating for ourselves, and I think
yeah,
you were a really good example. You trusted yourself,
mm,
you did some research, you presented it
mm,
to your medical team, and it really worked for you, because now
yeah,
you don't have to deal with the AFib. I think that's a really important point.
Yeah.
What do
Well,
you think?
as a matter of fact, right after my first diagnosis 14 years ago, I went to the educational forum in Minneapolis in the States, and it was a fabulous experience from all points of view. And I developed really I would say, a great understanding of, well, basically everything we've been talking about today. And within that forum, there was a visit to the Mayo Clinic in Rochester, and that was fabulous too. And had excellent contact with Dr. Ansel and Dr. Kurtz and Kyle and really Sherwood, Dr. Sherwood, who speaks very good French because he's from a bilingual Manitoba family. And so that was a very memorable and a positive experience.
Yeah, and that's why we encourage everybody, and everybody here in Canada did the WMFC survey, said we want an ed forum, even if it's virtual and we're not in person, but let's do this. So I know that's
Yeah.
why the WMFC put this at top priority to have an ed forum. So you know what? The newbies, the people in the middle of the journey, or the people way further along on their journey can hear and learn and be in community with other people going on a similar, maybe not the same, but a similar journey, and getting all the tips and tricks and learning the latest. Previously we heard Dr. McDonald talking about all these new treatments. I mean, it's an exciting time because you're talking about 14 years ago.
Yeah.
From then until now, like, look at all that you've
Yeah.
seen. Can you talk a
Yeah.
bit about that?
Oh yes, the scene has changed tremendously, particularly since these Bruton tyrosine kinase inhibitor has come on the scene. I don't know about the other ones, but about ibrutinib, it certainly was a game changer completely. And the other
Yeah,
point that I think is very interesting is the international network of specialists that is being developed in Europe and in Australia and all over the world. Uh, I think that's a very positive element in the whole community because the information, the sharing of information is more active than ever. Yeah.
absolutely. Absolutely. Well, thank you so much, Paul, for sharing. We're going to move on and hear from
Yeah.
Mark, who is also from Quebec. And we'll say bye to you for now. Mark comes to us from Quebec, and now we've heard from two people already sharing sort of like what, Chris called himself, it's kind of boring because his was rather typical. Paul has sort of moved along. He had chemo. He's on ibrutinib, doing great. So it's somewhat typical for a second therapy. Now we're going to hear from Mark and our next two speakers. Things get a little bit more complicated. So if you have complications, hear their stories and let's take some encouragement and hope from their stories. Hello, Mark.
Hi, Brenda. Hi, everyone.
Hi. Good, good. We want to hear your story. Tell us. I know it's a bit convoluted and we're going to try to stick with you as much as we can here, but go ahead.
Yeah, I'll try to get through it as quickly as I can. Usually that's a tough one, but today I'm 42, but my story starts, I guess, back in 2015 when I was 34. Otherwise healthy, occasionally going to see a GP, trying to go annually or starting to go annually. Of course, lo and behold, my GP found that I had high total proteins, which is a routine blood test. So after 2 or 3 repeated high tests, dug a bit further and saw that I had high IgM. Around the same time, I started to get that feeling of socks stuck between your toes, which is a typical feeling that people who start neuropathy get. And I can remember driving and feeling like, why is there a sock between my toe? And reaching down while I'm probably on the highway trying to get my sock out, but being confused to what I was actually feeling versus what was actually going on. But anyway, I was referred to a hematologist who at that time diagnosed me with MGUS, which is a precursor to Waldenstrom's. And I'd been referred to a neurologist who sort of said, okay, well, we'll watch your neuropathy, see how things progress. So went on for a couple of years like that. till late 2018. At this point, I was 37, married. Well, I was married previously as well. I married in 2014, but we had our first child in 2018. At this point, my neuropathy got quite a bit worse, and it was progressing quickly. Like my feet were getting numb. The point at which the neuropathy would stop, if you will, going up my leg, up my shin, and whatnot, was getting further and further up my leg, and so panic started to settle in. At that point, my hematologist, went ahead with some other tests, found, that I had the MYD88 mutated, CXCR4 was wild type still, typical Waldenstrom's patient from that perspective. My IgM wasn't terribly high from Waldenstrom standards. It was around 20. So they wouldn't necessarily treat. However, the neuropathy was an issue, and the rate at which the neuropathy was worsening was quite concerning. So we decided, we need to treat. Given my age,
sorry, I'm just going to pause you there. I think that's a really important point for everybody, whether you're a newbie or further along in the journey with WM. What did you just say? It was like the IgM wasn't necessarily, like, your numbers weren't necessarily showing, treatment, but you had a fast progressing neuropathy. And is that the decision point of we need to treat?
In my case, it absolutely was. It is atypical to have fast progressing neuropathy for Waldenstrom's patients, but there's nothing typical about my case, so no surprise there.
It's true. But I just I want our audience to know that it's like treat the symptoms, right? So don't get hung up on the numbers. Like, look at the numbers and your symptoms. So yeah. Correct. Okay, go ahead. Tell us the rest.
Sure. So at the time, my hematologist wanted to go a bit more cautiously. So he wanted to go with cyclophosphamide, which was a known treatment, which he had been using for years in other patients, not necessarily just Waldenstrom's. So it was more familiar versus Benda-R, which was newer. And he also wanted to precede my treatment with plasmapheresis. The reason for the plasmapheresis is because Rituxan is known to cause an IgM flare. So before the cyclophosphamide brings your IgM down, the Rituxan may make it spike, which maybe usually is fine. But in my case, because I had that fast progressing neuropathy, he didn't want my IgM getting any higher and causing neuropathy flare and my neuropathy suddenly getting worse. So he said, we'll do the plasmapheresis, drop your IgM down. And on the right-hand side of the screen, there's a bit of a note for anyone who's unfamiliar with plasmapheresis. Basically, they separate your blood, pull out the plasma, which usually contains the IgM, throw it out, replace it with albumin, and return that blood back into you.
How long does that process take, Mark? You're just saying take out the blood and mix it up? Like, is that
it's probably 2 hours.
Yeah. Okay, 2 hours. Wow.
Yeah, I mean, there's a lot of setup and a lot of stuff at the end too. So maybe it's an hour of actually, active on the machine, but 2 hours the whole appointment. But very effective, but also very much temporary, unfortunately, for the IgM, because you haven't treated the cause of the IgM. Your body will build it back up. And in my case, later on we studied that, and we found that within 2 weeks, the IgM was back by about 60 to 70%.
Wow.
So it's limited, right? But it's an emergency measure, right? So people with high blood viscosity, which is very concerning, they may get plasmapheresis just to buy time before they start the treatment. Anyway, plasmapheresis or Plex failed. It didn't work. I did 5 sessions, no drop in IgM. Dumbfounded, no one knew what was going on. Doctors had never seen that. Nurses scratching their heads, no idea. Next slide, please. So early 2019, of course, panic is still settling in. I have cancer. I'm, I guess, 39 or 40 at that point. We decided to go see Dr. Castillo for a second opinion. It was a great experience. We went to Dana-Farber, had a full blood work and biopsy done there. Did the full workup. And to this day, like, I could literally email Dr. Castillo and he'll answer within a day. If I have a question or concern, I have chain emails between my current hematologist and Dr. Castillo, and the three of us are chatting by email. So it was awesome. a great decision, to go there, because you have that link. I'm hoping and guessing forever as a result of having seen him. So Dr. Castillo agreed, yes, we obviously need to do something because of the neuropathy. But he said, again, your Waldenstrom, your IgM is not that high. Your other blood is relatively normal. Like, we really don't want to treat Waldenstrom's unnecessarily. So let's make sure that the neuropathy is due to the Waldenstrom's and nothing else before we actually go ahead with chemo. So I did a whole bunch of tests, sural nerve biopsy, where it actually cut out a portion of your nerve, sort of down near your ankle, fat pad biopsy, blood test, amyloid tests, cryo tests, etc. They tested everything to make sure that the neuropathy was really due to the Waldenstrom's, and that's how it came back. There was nothing else. Nothing else could explain the neuropathy. So despite the Plex failure, we decided to move ahead with the treatment, the cyclophosphamide, dexamethasone, and Rituxan treatment. At this point, I had only one child. I was still relatively young, and my wife and I decided that we would pursue fertility preservation, not knowing what the chemo would do to me. So if anyone has questions or whatever about that, I'm happy to explain the process and how things work, etc. With that from that perspective. Excuse me. So April 2019 began chemotherapy, the DRC, and first treatment not too bad. Second treatment worse. Third treatment was terrible. With each treatment, my neuropathy would worsen for like a day or two after, and then it would get better. Second treatment maybe 3 or 4 days. After the third treatment, the neuropathy flare was extreme. That very thing that my doctor was worried about had happened. So the neuropathy also spread. Initially, it was just in my legs and arms. Legs and feet. It had spread then to my hands and my arms, and also previously it had just been sensory, and now it was muscular. So my legs became weak. I couldn't climb stairs. Foot drop was an issue because my ankles were so weak. So my toes wouldn't lift when I would walk, and I would trip on the slightest, uneven surface. So I had to wear braces because of that, and pain. I just developed the most intense pain, that you can imagine, and it's almost like oozing out from my bones. It was weird, honestly. So of course, pain meds, sleeping pills, everything to deal with this, and of course I had to go off work. I had managed to do the 3 first rounds without going off work, although I'd be sick or whatever for a day or two. But ultimately, I could deal with it. And I will agree with what Chris said. Take your nausea meds. Don't bother trying to bypass it. Just take them. Down at the bottom, something that I'll always remember and sort of brings a tear to my eyes every time I think about it is there was a point where I couldn't carry my son down the stairs. I wasn't confident, so I would take him on my lap and go down the stairs on my butt, and he thought it was great, but it was so so sad for me. So
humbling, yeah.
Next slide, please. Okay, so June 2019, doctors are panicking, as am I. So of course we decided to stop the chemo after the third round. Should have been 6, but we stopped after 3. Neurologists said, okay, well, we're going to start IVIG infusions, which is basically IgG replacement, if you want to put it that way. They put me on ibrutinib because I still had a high IgM. And they said, well, let's try Plex again. We don't know what happened, but let's try plasmapheresis again. So the worsening of my symptoms seemed to have stalled. So that was good. And slowly the pain was getting better. Symptoms started improving very slowly, but, at least it wasn't getting worse. However, I still had a high IgM. I still needed to be treated, and ibrutinib, unfortunately, in my case, had minimal effect. My IgM dropped from about 20 to about 15, and stalled there at around 15. Fast forward to August 2019, still sort of no plan coming from the medical team. My brother and I, who are both engineers, sort of got together and decided that there's no reason plasmapheresis shouldn't work. It's got to be a machine issue. It's got to be a user issue. Something's going on. Someone's dropping a ball here. So, while the doctors decided to attempt more plasmapheresis, we started studying it. We read up everything about it. We documented machine settings, results, read the manuals, contacted the manufacturers, decided we were going to figure this out. Of course we didn't. And one of the last sessions that I had of the Failplex was actually in St. Michael's in Toronto. They thought, oh, well, maybe if we do the whole process in a hot room, so basically a body temperature room, so the blood doesn't have any chance to cool down, maybe that would help. Unfortunately, it didn't. On the right-hand side, I also mentioned that, cramping started. Cramping could be a side effect of neuropathy. If there's time at the end, I can talk a bit more about that, but the cramping was awful. Unprovoked, it would come on. I would be on a meeting like this and, for work, and then all of a sudden I'd be paralyzed in pain from a cramp. And, you read on Google or anywhere, what could you do? So magnesium supplements, tonic water apparently is known to help. The quinine that's in it, as well as pickle juice, like literally the juice out of the jar. If you're really in a bind and you can't get out of a cramp, try a shot of pickle juice. I think it sort of distracts your nerves. Placebo or not, I don't know.
I've heard that from others in our group too. The old pickle juice trick. I mean,
yeah,
you're desperate. You'll try whatever, right?
Exactly. So none of it fixes any of it, but I do believe all of those three help, or at least help, lessen it.
Good tip.
Yeah. So So at this point, tried more plexes. Things are stalled. I still need treatment. The doctors didn't know what to do, and really, I felt at this point where the doctors were just waiting. If we treat him, he may get worse. His neuropathy may flare. Who knows what will happen? I don't know how far it can go. Can go to paralysis? I don't know. But it felt like the doctors were going to wait until they could justify treating me, despite knowing the treatment could, have a devastating side effect on me. So yeah, that graph on the right hand side, just one of the many graphs of data plotting like the different ways to measure IgM and M spike versus my plasmapheresis sessions versus my cyclophosphamide and ibrutinib start and my IVIG cycle. So it's all just an example of the
that would be the engineer in you, right? That's the engineer in you speaking.
I must credit my brother. He did the bulk of the legwork, but we had many discussions about what's going on. And I clearly remember him saying, you don't have alien blood. There's something wrong here. It's a machine-related issue. You don't have alien blood. We'll see.
Okay, so, then what happened?
Yeah,
we're running out of time here.
I'll try to
accelerate it's a difficult journey you've had. Wow.
Yes, yeah. So early 2020, really, at this point, I'm really frustrated that we're not getting anywhere with my care team. There is no plan. There's no path forward. I don't know what I'm going to be doing tomorrow. I don't know what I'm going to be doing in 6 months. So we reached out to anyone and everyone, any contact, any secondary, tertiary, whatever contact we could. Someone maybe will take up my case and look into it. So right around February, March 2020, hematologist Amazonov agreed to test my blood and sort of give me a full workup again. And I remember that blood test because I think there were 4 people collecting my blood. There was like the nurse, a microbiologist, some other specialty, and so it was reassuring that if there's something to find, they'll find it. And we also submitted a data package to the Essentials and Advances for Apheresis Therapies medical conference, which is held in San Diego. Again, we reached out to every medical conference out there about plasmapheresis, and sure enough, these guys responded. They said, "Hey, this is a very interesting case. Do you want to come to our conference?" So, jumped on a plane. This is the beginning of March 2020. Jumped on a plane and went to this medical conference. Talked.
I'm glad you got the invite. I'm glad you got the invite because I thought you were going to sneak into it. Actually.
If we thought there was a way, we would have done it if we had to. So yeah, actually, while we were at that conference, I think on lunch break, we got some results from Mason Rosemont that said, "Hey, when your blood is in contact with citrate, it clumps up." And citrate is the anticoagulant that's used during the plasmapheresis process. So, get back from lunch to the medical conference and say, "Hey, we have some new information here." And we had this photo that you can see. So a normal blood tube, after it's spun, will look like the one on the right. So you have your plasma on top. There's a small white layer called the buffy coat, and then the red blood cells on the bottom. The tube on the left is my blood in contact with citrate. So there's that huge sort of blurry center strip, which is not normal, should not be there. Presented this to the doctors, experts really in plasmapheresis throughout the United States, and they concluded, hey, you need to do this process with heparin instead of citrate. Of course, that's never been done before. Plasmapheresis was always done with citrate. So we get back home after that conference saying, okay, we're going to get a doctor to do plasmapheresis with citrate. Oh, sorry, with heparin. And of course, COVID hits. COVID shuts everything down. And, so we're trying to get someone to treat me. My primary care institution is saying, sorry, we can't do this. It's too risky. It's off protocol. No way. Mason of Rosemont and St. Michael's in Toronto, they said, okay, you know what, we can try this, but it's COVID, sorry. So, it's going to have to wait a bit. And Dana-Farber said they don't do plasmapheresis, but they could try a different technology to try to filter my blood out. And of course, UC San Diego, who had hosted the conference, they said, sure, we'll do it. You just got to get down here. But, because of COVID, we couldn't travel. So next slide, please. July 2020, we have our second child. So if you go back 9 months, it's actually when everything was failing. I don't know why we decided to have another child there, but I'm very, very glad we did. So July 2020, we have our second baby. And then in the fall, Dr. Ryan Kedby at the Jewish, who's my doctor now, we got in contact with him somehow through some distant connection, and we managed to get his attention. He said, sure, we'll try this plasmapheresis with heparin, no problem. So we did it, and textbook results, 60% reduction in my IgM after the first session. And so we had sort of cracked the Plex mystery. He actually went on to write up a medical paper about my case, and there's a link there on the screen if anyone wants to scan that. I put a copy on the WFMC's drive. WMFC, sorry. So then late 2020, after switching to Dr. Kedby as my primary care oncologist, I could finally start treatments. At that point, since within 2 years, I'd had cyclophosphamide, ibrutinib, a whole bunch of stuff. He said, let's go with carfilzomib. It's not as known for Waldenstrom's, but it probably will work. And it's quite light. It's not tough on the body. So, we did that. Before I would do each Rituxan infusion, they would do plasmapheresis, get my IgM down, give me the Rituxan, which would bump it back up. But, because we were able to get it down, I was able to get through it. During the 6 rounds, which I completed no problems, I didn't even stop. I didn't even have to stop working. No nausea. At one point I said, I think you're infusing me with saline, because I don't think I'm getting chemo here. But sure enough, my IgM dropped relatively quickly. We could stop the plasmapheresis after the second round, and also we started weaning me off ibrutinib. Ibrutinib is known to cause IgM flares if you stop it abruptly. So, I would go down to 2 pills, 1 pill, and then 0 pill. And I completed all 6 rounds, no issues. So next slide, please. So since finishing my last infusion, which was June 21st, 2021, my IgM ended at around 3.5. Sorry, I lost an earbud. Let me know if you can, if there's an issue hearing me. But so my IgM finished at around 3.5. So nearly within the normal range.
Wow! Finally, right?
Yeah.
Finally, something worked.
Exactly. And it continued to slowly drop and stabilize with each, follow-up monitoring appointment. So right now it sits at around 3. At this point, I've discussed with my doctor, well, what happens once it comes back? Because we expect it will come back. And he said, since it have gone 2 years and carfilzomib was so well tolerated, we'd probably do carfilzomib again. If it worked once, hopefully it's going to work again. And, rather than introduce another drug. The treatments have left me with a low IgG, so I am prone to infections. I went through a year of coughing and many sinus infections. So today, the only thing I do is IgG injections, which I could actually do at home. It's basically antibodies that are extracted from blood. So it's an antibody replacement, if you will. Mm-hmm. And with respect to the neuropathy, the sensory losses have largely remained. The tingling, is arms and legs, unfortunately, but you get used to it. Muscular losses, I've recovered, I'm pretty sure 100%, although it was slow. It took over 2 years. And cramping is also largely better, about 95% better. So yeah, I'm glad about that. this graph is on here is actually my
I do see
IgM.
that little
Yeah,
point. Sorry, I see that little
yeah,
point that you still drink the tonic water, but now it's with
yeah,
gin.
yeah. It had gin before sometimes too, but now it always does. So so yeah, and this is so the graph's my IgM essentially, from the start of whatever data we have available, and you can see where the quick drops. That's Plex in all its wonders, although it's temporary. So
Wow.
yeah. So May 3rd, 2023, our third child. So picture here of my kids. And most recently, October 1st, I completed the Jimmy Fund Walk, which is a walk of the Boston Marathon route. And we raised $4,500 for the Dana-Farber Cancer Institute. Yeah, my little blurb there of why I did that walk. I have a brother and sister that did it with me, so it was very it was very emotional, and it felt like a great accomplishment. I can't remember the last time that I walked a kilometer, and so the fact that I was able to walk 42 kilometers in a day
Wow.
was amazing. It was tough. It was tough, and I paid for it. I paid for it for several days afterwards. But hey, I did it, and I'm good now.
I feel like that's
My
a good bookend for you after this whole journey. And I love how you say that it was to defy the cancer journey that you'd been on, right? To be
hmm,
like, I'm going to do this.
yeah,
I love
yeah,
it.
no, absolutely, yeah. And I guess my three quick takeaways for the other patients on this seminar: don't give up. Waldenstrom's and or neuropathy don't need to stop you. I largely continued working in all my story. I think I was off work for 3 months or 4 months.
Oh, that's amazing.
Yeah, travel if you want to travel, walk a marathon, run it if you can. Although I couldn't run one before, so get back on the ski hill. Last year, I went skiing for the first time since I've developed neuropathy. Nerve-wracking, scared, but you know what? It was easy. It comes back, and you don't need to be afraid of neuropathy. And have kids if your age permits. Yeah. So surround yourself with a support group and people who can advocate for you on your behalf. My wife has been a huge help. My siblings as well. I have an aunt who is actually, largely very much involved with WMFC. So it's all people that have helped me. And the number of times where I've needed a follow up, I just want to leave the hospital and sort of go home and be sad. And my wife's like, no, we're going to get that appointment right now. And that really helped accelerate things. And it's really, you need people there to push you. And don't be afraid of the doctors. I actually changed oncologists twice, so I'm on my third oncologist. First one, incompetent. Second one, good, but refused to explore my Plex situation. And now I'm with Dr. Kedmi, and I'm very much happy. I've also consulted with probably 3 or 4 oncologists on the side when trying to get second opinions or whatnot. And likewise, neurologists. I changed a couple times, and really now I have an oncologist and a neurologist who are focused on me. They know who I am. I can email them. They're on my side. They're watching out for me. And if ever you think you may deserve better from our healthcare system, even if it's quote unquote free, well, we're all taxpayers, right? So we're all paying their salaries. But if you feel you deserve better, trust me, you do deserve better. And get that second opinion. Switch doctors if you need to. You won't regret it.
Wow, what a story and a journey you have been on. I can tell there's been some really tough times, and I appreciate you sharing all the ups and downs with us. And you're along the way, you shared some tips and tricks as well, and some tools. And do you have any last parting maybe tips or advice for young WMers?
Really, it would be not to let it stop your life. If you want to have kids, have kids. I'm at a point where I'll be working for the next 25, 30 years, I guess. So get back there, keep working, and be active. Don't let it derail your life. Long life to live. I'm planning on setting the record for years lived with Waldenstrom's. And so, yeah, if you want to compete with me on that one, you're more than welcome to.
That's awesome. That's awesome. And I say that I've said this many times with our BC Wallies group. I was like, in my lifetime, there will be a cure for WM. And I'm challenged by my other veterans within my group that they say that there will be a cure for Waldenstrom's within their lifetime too. So we're on the green growing edge of this diagnosis and getting closer and closer to managing it well for long periods of time. And then, hey, we're going for the cure too, aren't we?
Yeah, absolutely.
Awesome. Well, thank you so much. And now we're going to hear from Dean. We're going to go over to the West Coast of BC. So Dean, I do know because he's in the BC Wallies WM support group. And he's coming to you from Prince George. And he also has a little bit of a roller coaster, somewhat complicated journey with WM. Well, is it WM? Let's hear from Dean. Where are you, Dean?
Hello. Hi, Brenda. Hello, everyone.
Hi, good to see you.
Boy, those are 3 good talks there. That's going to be hard to follow up with that, but I'll try my best. Yeah.
Yeah, you'll be fine. Oh,
All
what's
right,
this? LPL and Big Neil? You're changing the letters on us. What's going on?
Yeah. Well, we'll get through it. I'll explain as I go here. How's that? If you can
Sounds
get
good.
to the next slide there, and we'll go that. So I have Bing Neil, which it's a pretty rare syndrome there. As you can see, apparently unicorns are about the same as rare as that, and I am looking for a unicorn. I haven't found one yet, but I do have Bing Neil. Next slide, please. So I live in Prince George. It's pretty small, 74,000, about 8 hours north of Vancouver, but it has all the amenities. I did all my treatment here. I flew to Vancouver a couple times just for some more specialist stuff. So yeah, I'm pretty lucky to live in Prince George. I love it. Next slide, please. A little bit about who I am. Married, no kids. My wife and I, we're pretty outdoor people. We volunteer search and rescue. I have a construction company, had that for 30 years. My wife owns a outdoor education center, indoor climbing gym. Got a good support network of people, of friends and family. Yeah. Next slide, please.
A charmed life.
It is a charmed life, and I'm lucky to have it, yes. So in 2020, in the new year, I got pretty sick there, and it dragged like everyone seems to have when they get WM, and through a bunch of tests and stuff that I don't really want to get into because I think it's all been covered, but it was discovered that I have something called lymphoplasmatic lymphoma. So where the WM group, you have high IgMs. For me, it's my IgA that's kind of gone wonky. So yeah, but luckily I get to hang out with all you cool WMers, and I get treated kind of the same. It's pretty close.
Yeah, you thought you would be so special, and here we are treating you the same.
I know. That's it. I did the usual 6 rounds of bendamustine rituximab. I treated it fairly well. Just the last week there, I got a little sick, and we just pushed it off. But next slide. So when I finished, like everyone else, I got to ring the cancer bell, and then I had a surprise party outside with a big blue dinosaur and all my family and friends. During this time, this is right at the height of COVID, and we kind of decided not to go with the rituximab maintenance shots. And I don't know if it was a good idea or not, but I'm fine with it. I was pretty happy not to do those. But again, yeah, a little bit on my recovery there. It's about 6 months it took me till I got back to kind of normal. And during this time, this is when I discovered the WM support groups. The big one is the BC Wallies, and then also Young Waldenstroms. And it was a bit of a game changer just to see people have lived with this disease for 30, 40 years and live a decent, a good life. And then young people that had it, younger than me, and they were getting along good and lots of good ideas and stuff. So yeah, I was so happy to find that. And then I was generally happy, or healthy, excuse me, for probably a year and a half there. And during this time, I went and saw a bone marrow transplant doctor, kind of a team in Vancouver. And we talked on it. And I have two siblings, they're older than me, but that are a perfect match. But at this time, it was, I've only done one line of treatment at that time. And, I was young, I was healthy. It might be a good time to do it. But also, they said, you know what? Let's just kind of keep it in our back pocket. There's more treatments if it comes back, or when it comes back. We'll keep this for a last resort, I guess. Next slide.
And I'll just ask you a question
Sure.
there, Dean. So, how were you when that was first presented to you by somebody that we both know about doing a transplant as a possible treatment? How did that go over for you initially?
Yeah, I was kind of scared about it, but I've also wanted. There's something going on with my body for a long time, and my calves, they've been twitching for about 5 years up to that point. So I knew there was something weird going on, and neurologist just told me to live with it. But deep down, I felt, if this could be a possible cure, I would kind of go through it. But it looks, it's a pretty scary thing, and I was kind of happy when the doctor said, because when they leave it for you to decide, it's a little bit different where the doctor says, you know what, we're not going to go this route. And I was kind of happy that they kind of made the decision with my input.
Yeah, it's definitely a scary idea, but I like what you said. You wanted to keep your options open, and you walked through what you needed to find out to talk to somebody about it. And like they said, let's keep this in the back pocket because there could be something even better coming along. So where does your story then take us?
So I started noticing some things August 2022 there. I went to run across the highway and I just about got run over because I couldn't run. My legs, they just didn't work, right? And then I had trouble with stairs, kind of like as Mark was, like the trouble he was having. I had to use my arms to pull me up the stairs, right? If there was no railing there, I just couldn't do them. And I lost lots of weight. I lost 30 pounds over 4 or 5 months there. And it was just kind of a slow decline. Everything was really slow. And then I started getting pain in my legs and I started getting shooting pains. Yeah. And one thing was my IgA it wasn't that high. It was what they call a little high, but it was nowhere near when I got treated. So, it wasn't really a concern. I guess it should have been, but at the time it wasn't. Next slide, please. So during this time, all along I'd been seeing a neurologist locally in Prince George, and just like Mark said, you can see, you can get some bad doctors, and I wouldn't say he was bad, but I just didn't get along. I didn't like his attitude. So I kind of talked with our support group and come up with a good young doctor in Vancouver, and I thought maybe he sees more difficult patients and stuff in a larger center. So I saw him twice, and the second time I saw him, it was kind of right at the peak of where my symptoms were really bad. And he kind of misdiagnosed me with ALS. And I remember him telling me that he thought I had ALS, and in my brain I was like, no, this is something to do with my cancer, because it felt a lot like cancer, but there was some different things going on. In his credit, it's just so hard to tell. So I was having lots of pain in my legs. I had muscle twitching, and it was starting to go all over my body, just not my lower part of my body. But that's where most of it presented. So it took about 6 weeks before I could go see the ALS clinic. And during that time, I kind of had to convince myself I had ALS. And over that Christmas...
That was probably a long 6 weeks.
Yeah, it was over Christmas, and we got my affairs in order, and yeah. But I did get in to see the ALS doctor, and he poked and prodded and spent a long time with me. And he said, I don't think this is ALS. And the reason is ALS presents all over the body. He said, this just seems to be your lower half of the body. The upper body, would be weak. You'd have muscle problems. And my upper body was still quite strong, right? So that was a pretty good thing, but still confusing.
Yeah.
Next slide. So a bunch of more tests. So finally, I was able to meet with my hematologist, and that was the first time, excuse me, I felt like someone had actually knew what was going on with my body. And I'd talked with my support group there, and we had kind of come up with two things. And when I talked to the hematologist, he was in the same agreement, and it was either something called Bing-Neal, which I didn't think it would be, or peripheral neuropathy, which that's what I felt I had. So I had to run through these tests. The first test had to be MRI. And again, you have to advocate. They had put me on a 3-month waiting list, and I phoned them every day. And eventually they bumped me up to 2 weeks, and I got in and did the bone marrow, or did the MRI. And it showed nothing. Everything was good. So then I did a bone marrow biopsy. And the bone marrow biopsy, it showed that the cancer was still in my bones, but it hadn't progressed much since my last treatment there. But the key was a lumbar puncture. It had showed that some of the cancer cells had got into my spinal fluid. Next slide, please. So we determined it was Bing-Neal, and for me, what's going on is the cancer cells are attacking my nerves that are running to my legs. Now, I'm not sure if they're attacking the nerve sheath or the cells, but that's kind of what we've decided. I started Zabrutinib in March 2023, and for the first month, it was horrible. I felt like I was back on chemo, but slowly I got better. My body got adjusted to it, and I started gaining weight right away. My muscles they come back in my legs, but the nerves are taking their time, but they're slowly coming back. And when we found out it was
Can we talk about that picture, Dean?
Yeah, I'll talk a little bit
picture?
about that. We went out and celebrated because it
You're
wasn't
celebrating
ALS.
for Bing-Neal. What?
I know Bing-Neal sucks, but ALS is a lot worse. And getting misdiagnosed is a bit of a blessing, because now I feel like I can take anything, right? Like Bing-Neal, yeah, it's tough, but there's hope and there's treatment for it, right? And there's people that have had it and survive it and live with it. So I'm just thankful for it. Yeah.
And you're in the pub celebrating with your friends and family.
Yeah,
That's awesome.
drinking lots of gin and tonic, as Mark says, for my muscle cramps. So during this time, I reached out to the Leukemia and Lymphoma Society. I wanted to see if I could get in on a clinical trial. And then they put me in touch with a clinical trial nurse. And they wanted me to get a second opinion before seeing if I could go into any clinical trials. So I reached out to the WM Society, and they put me in touch with all these WM doctors on their website. And I kind of did some research to see who deals with Bing-Neal, and figured out Dr. Castillo I felt was kind of the best. And I emailed him a couple times. The second time he got back to me right away, put me in touch with Boston, his team in Boston, and it was super easy to deal with them. The interesting thing is I had to send them all my results, all my tests and everything, not just the results. So they wanted to see all the slides, all the smears, the blood smears, all my biopsy. I had to go get an MRI or get a CD from the MRI clinic there and then ship it to them. So their team went over everything just to make sure it was not some other disease or I was misdiagnosed. And then we had a meeting with my hematologist, the bone marrow transplant, Dr. Castile, and my wife and I, and it was really good. Everyone's had my best interest, and Dr. Castile said, like, what you guys are doing, you're on the right track. Let's keep doing that. I'll talk a little bit about the two gentlemen in the picture here with me. I met them through the support group that Brenda's part of. On my left, or the shorter guy, I guess, on my right on the picture is Brian. And he's very inspirational. He's 10 years older than me, but he mountain bikes, or he does tons of biking, and he's out skiing every day in the winter and stuff. So I'm like, if he can do that, I should be able to get out. Excuse me. And the other fella is Joe, who we've kind of been talking about, Brenda and I. And he is the most amazing person. He knows everything, and he's lived with this disease for I don't know, Brenda, 30 years. And
It might not be that old. We might be calling him out as being too old, but it's been a really long time.
But he's been great, and all the doctors know him and everything. And when he explains stuff to you, it's in layman terms. I can understand how he explains it, right? I'll go for the next slide.
A definite blessing in our group, because when we don't understand something, he explains it to us. So thank you, Joe. We appreciate you.
Yes. Is he moderating right now with the doctors?
Tomorrow.
Forum, I believe. Tomorrow. Yeah. So this is a little bit of just in my recovery. Again, the squeaky wheel gets a grease. I wanted to see a physiotherapist at the hospital who specializes in spinal injuries. And it took me quite a while. It took me about 2 months to get in, but she was amazing. I'm so glad I was able to see her. She just explained stuff that I could understand. And then we brought in, I have a personal trainer, she come in, and we kind of come up with a bit of a plan for me just to keep working and getting my muscles and my nerves working with them. The one thing I would like to talk about is, we call this a pup tug, but we got a pup there. She's about a year old now, and we've trained her to be my support dog. So when I get tired or when I'm hiking or something, I can call her over and use her to assist me going up hills or going upstairs. And it forces me to go out to take her for walks and stuff. So as Chris had said earlier, you need to get a cat or a dog, just something to keep you going.
That's awesome.
And the last slide here is just some websites that I think are pretty important and that I used.
Yeah, that's awesome. Wow, what a roller coaster to thinking you have ALS, getting your affairs in order, to celebrating at the pub because you have Big Neil. And what a perspective, right? Perspective. Yeah. And I love how you're getting better and better every day. And your positive attitude, I think, it is really to be acknowledged and honored. And for all the rest of us, take your inspiration. Like Dean said, he's inspired by people within our BC Wallies group. Everybody's living with something, and everyone is still living their life and having a great time, because do what you can when you can and enjoy it. Any last parting words you have, Dean? Because you're also a young WMer, per se. The young WM group is for those under 50. Any shout outs there about being diagnosed and young, kind of like we've heard from Mark?
Yeah, they were another good group that helped me diagnose what I had too, right? And again, they're just two different groups, but talking with them, that's inspiration with them. Like there's people in their 30s that got it and stuff, and it's pretty good. And lots of, I learned lots about what to look for and to advocate for myself and use all my cancer resources, right? Like there's so many resources the Cancer Center, at least our Cancer Center, puts out that I think people don't really use, right? Like I see a counselor, and then if I need to ask questions, I can kind of go through email through her, and then she can email my doctors and stuff. And it's there's lots of stuff out there that we need to take advantage of.
Awesome. Yeah. And I know you inspire a lot of people as well, because we've watched you as you first came into the group, a little bit shell-shocked from what you've just been through. And now look at you. You're presenting here and sharing your journey and helping and inspiring others in the WM community here in Canada. And I just applaud you for that, because your confidence is there and you're using anything and everything like you just shared with all your resource, the support groups, your friends, your family, and all the collaboration with your medical team is amazing. And this is just a little inspiration too for those that live in smaller communities. Not all is lost. You don't always have to go to the big communities. You did for some specialists when you wanted to. And then also the second opinion thing. I saw that in the notes that said that you'd spent $3,000 Canadian. I mean, it's a chunk of change, But what a good investment. Has that given you some just calmed any panic by hearing from Dr. Castillo?
Yeah, for sure. And he's been wonderful. I sent him an email, asked him about some COVID stuff, and he got back to me a couple days later.
Yeah, so you're on that direct line that who was that Mark said he's on too. So you can just email.
Yeah.
So that's
Yeah,
one of the perks, right? But I can imagine it just really brings down any fears and just increases that confidence of trusting yourself and your medical team to do what you need to happen. We love having you in the group, Dean, and we love your inspiration. Anything else?
I mean, I could go on for quite a while, but like
you're probably going to give us the hook.
Yeah, that's for sure. But I think that when you do get diagnosed, everything happens so fast and it's so complicated. And for the first 6 months, I thought I just had non-Hodgkin's lymphoma, and I was on a support group just for people with lymphomas, and no one had the same symptoms I had. And finally, I asked. I said, "Well, what's going on here?" to the moderator, and I told her what disease, and she was like, "Well, here at Waldestrom's, this is the support group you want." So that's how I discovered WM support groups.
Yeah, it's awesome. I love how we all seem to have in our journey, you get little crumbs of here, there, and everywhere, and you kind of piece them together and just keep following along, and you come upon these fantastic things that is just like a total life changer, game changer, right? That's awesome. Well, it was wonderful hearing your story. Do we want to bring in everybody else? I know we're going a little bit over time, but I didn't really want to cut off anybody because I think this is really important for the WMers in Canada to hear from those of us that have walked through this journey, some rather boring, as you say, Chris, to more complicated, and then also from Paul, like 14 years in. If this isn't an inspiring group, I don't know what is. So I didn't want to cut off anybody. We're going a little over time. Blame me, doesn't matter. But I think this is really important. And I just want to ask a couple of questions here. You've heard a lot of talk about neuropathy, and I know this is a hot topic. It's a hot topic in our support group. I'm sure it's a hot topic in every support group. I know there's not necessarily a cure to it or to make it stop, but there's ways to manage. I don't have that experience, but what is some of those of you that have neuropathy, what are your ways to manage this best, other than the tonic, sometimes with gin?
Well, I mean, from my perspective, really, you sort of have to decide that you're going to learn how to do all the things you were doing before, and then slowly, learn them again. Skiing was one. I used to ski a lot, and I hadn't skied in several years now. And last year I decided, okay, I'm going to try it. And hey, I started on the bunny hill. I hadn't been on a bunny hill in 20 years, but last year I was back on the bunny hill, and you know what? It wasn't so bad. And now actually I bought new ski boots this year because I decided that, hey, if I'm going to get back skiing, I'm going to equip myself with all the bells and whistles. So it's really cautiously, relearn and force yourself to do all the things that you used to do and enjoy before. And if you have to walk with a cane, so be it. For a long time, I didn't want to wear the AFOs, the braces, but I wore them. Today, I don't have to anymore because thankfully I've regained enough strength. But don't let those things stop you from enjoying your life and doing the things that you want to do.
Yeah, I'd echo that. Be active, and I think that's one thing that does help. If I sit around, it seems to bother me more if I'm active, and I don't push it, but I'm active enough, keep the blood flowing. That seems to be the key.
Chris, they might be coming after you in that marathon.
I'll be looking out for them. I hope so.
Chris, do you find that helps as well?
I had no neuropathy at all, so I was very fortunate. But the exercise, getting out there and pushing yourself just that little bit more than you think you can do each day, yeah, it's as much about mental benefits as it is about the physical.
Yeah, so true. Paul, what did you have to add?
A doctor once told me that neuropathy is a very scientific term to call something we don't understand.
Yeah, very good. Very good. Now, I know we had some questions from the audience. We're just going to briefly go over them. One of them was about the bend and retux and side effects, but that's like as you get to cycle 4, 5, and 6. Now, I think everybody sort of referred to it that things increase in terms of your side effects. What exactly happened at 4, 5, and 6? Anybody?
I'll start because I was the kind of classic Ben Ricks guy, and yeah, it's just that all of the side effects that you've had in the previous cycles are tend to be there, but in spades. And particularly the tiredness for me, the exhaustion was really crowding out other stuff or trying to. So those last couple of cycles, it was even more important to just get out there and just walk around the block or do whatever it took, get 10,000 steps in to keep it going and pushing it back. And I think, again, the exercise does help, but the effects are indeed cumulative. And so the last couple of cycles, certainly for me, were the most tiring of all.
Dean, you had that experience too. Is that right?
I did, yeah. Yeah, and it was quite a bit of pain. The more it just cumulative, right? I remember I'd be in the backyard and I'm just looking over there right now, and I grabbed the wheelbarrow and I was like, okay, I'm gonna push this wheelbarrow over and go rake some leaves, and I pushed it 10 feet and I fell. Then I laid down and had a snap. Where my wife was working on the roof, cleaning the gutters. I was like, well, I'm gonna go up there and help her, and I climbed the ladder up, and then I slept by the chimney because I was just so exhausted. So.
Yeah, fatigue, right? And not
Yeah.
no joke. No joke with the fatigue. And I know somebody else's question was, did anybody's bend and retux treatment stop because of severe side effects? Now, I think you've shared that you all had 6. I'll share my story. I had round 1 and round 2, and I was all ready to go for round 3, except those blood tests that Chris told you to get before early enough so that your oncologist can actually read them. My neutrophils were down, down, down. They never really bounced back up. So each week I got delayed by a week, with the oncologist expecting that my neutrophils would go back up, but they never did. I was 0 point something, and you have to have 1 or better to get another treatment of chemo, and mine never went up to 1. And the oncologist said in no uncertain terms, is she comfortable giving me any more chemo? This is the oncologist saying this, so panic sets in then. And I only had 2 rounds. Fast forward on my story, I went through all of my tests again, a bone marrow biopsy, scans, everything. And it showed that there was no more notice of the Waldenstroms. It was undetectable. So I'll take that as I'm in remission, I'm healed, I'm living healed and living large. They say it might come back, but it's not invited back into my life. So I'm going to go the distance as long as I can. Now, Paul, you said you had 2 rounds as well. I was wondering, did yours chemo stop, 14 years ago for a specific reason?
No, it just went through the cycle as planned. And I did have a point where I needed to take, what is it, nitrogen? Somebody mentioned the name, this to increase the blood, the white.
Neupogen?
Neupogen, yeah.
Yeah.
I did have that, needed that during the first round, but that was all. I mean, it went very well. So, and
Good,
the
good.
second time around was the same. I just went through the whole cycle and had excellent results.
Awesome. Well, thank you so much, guys, for sharing your journey with WM. I know you did a wonderful job, and you've inspired everybody across Canada with your stories. Thank you for stepping maybe outside of your comfort zone. And I'm sure if anybody has any other questions, they can reach out to the WMFC. And you know what? Find your local support group and be with people that know what you're going through.